These are my audience members, Billy Anderson, and the person holding the camera is my husband, Nathan Shonak. And I'm Sarah Haeder, and this is my informative speech. The Dakotas have always been seen by the rest of the country as the last frontier, the Wild Wild West. Well, the North Dakota legislature passed bills attacking women's rights and bringing them back to the time of the settlers. That gives the Wild Wild West notion some substance. Regardless of your political affiliation or your stance on women's reproductive health issues, all women in North Dakota are going to be affected by the bills that were passed by the legislature. I've worked at the Red River Women's Clinic for 3 years, I should say, and they are the only abortion clinic in the state of North Dakota. This is an example of a sign that is hanging on the building, showing women that they have support as they come into the building. The recent legislature has wiped out women's right to control their reproductive life autonomously, and after viewing this video from the Guttmacher Institute about abortion, we are going to discuss 3 aspects of choice and why it's important to women.
Who are the women who obtain abortions in the United States? You might be surprised. Almost 1 out of every 3 American women will have an abortion by age 45. They come from all walks of life. They are women you know. Most women having abortions are in their 20s. Many people mistakenly believe that teens are the group most likely to have an abortion. Teens actually account for fewer than 2 in 10 of all abortions, and most of them are older teens, those aged 18 and 19. 6 in 10 women having abortions already have a child, and many have 2 or more. They know what it means to be a mother, and they often cite the need to care for their children as a primary reason for deciding not to have another right now. 3 out of 4 women who have abortions describe themselves as religiously affiliated. Catholic women have abortions at about the same rate as women overall. Over the past decade, abortion has become increasingly concentrated among poor women. In 2008, more than 4 in 10 abortion patients had incomes below the federal poverty line. That's a huge increase from a decade ago. White women account for 1 in 3 abortions, more than any other group. However, women of color are disproportionately likely to have an abortion. The reason is that Black and Hispanic women have much higher rates of unintended pregnancy. These trends reflect widespread inequities in other areas, not enough access to contraception and to quality, affordable health care, and not enough educational opportunities and good jobs. These broad social and economic inequities must be addressed, but at a minimum, contraception should be easy to get and use for all, and comprehensive sex education should be available to all adolescents. But while prevention is key, there will always be women who need abortions. That's why abortion is basic health care for women. It should be covered by private insurance plans as well as under public insurance programs such as Medicaid. Covering abortion under Medicaid is critical to help the poorest, most vulnerable women pay for their procedure. Any woman who needs an abortion should be able to have one safely and with dignity.
So what are the aspects of choice, and why are they important? The first aspect is obviously prevention and education are essential, but the reality, like in the video, as Guttmacher said, there's always going to be need to access abortion services. The reasons for that are several, but one would be that no contraception is 100%. You know, even women who have stable economic and financial situations and are married and have a wonderful home life decide to have an abortion. A doctor he was an abortion provider in the South, his name is William Harrison, he said that as hard as a woman tries to not get pregnant, her body is trying 1,000,000 times harder to make sure that she will. The other reason why it's important to have access to abortion is that there are always going to be rape and incest cases. Rapes happen in the United States, according to the Rape and Abuse Crisis Center here in Fargo, every 2 minutes. So, as you can imagine, being able to carry a pregnancy like that to term would be fairly traumatic. So facing the reality of abortions and the fact that they are always going to be necessary helps us move past whether this is a right or a wrong issue. And we realize that a woman's biological function in society, which is to bear children, does not automatically render society as the decision maker for her. The second point is that individual self-determination and access to both services and good, reliable, factual, scientific information is essential to human dignity. Opposition to sex education, contraception, and abortion, and then judging others for being irresponsible is very hypocritical. And that is what the opposite side, the anti-choicers, take. The Guttmacher Institute did a paper on facts about unintended pregnancies in 2012, and they found that publicly funded family planning services help women avoid unintended pregnancies, and they also help them plan for the pregnancies that they do want. So if we give women the tools needed to make smart and successful decisions for themselves and their reproductive lives, then you're going to get a better outcome. The main reason why women are unsuccessful is that they have inconsistent use or incorrect use of contraception. And 43% of unintended pregnancies come from that. So if we require autonomy in our medical decisions, then it's only logical that we would want to maintain autonomy in our health insurance coverage. So health insurance coverage, both public and private, as stated in the video, is instrumental in providing women the financial safety net that they need so that they can make important and tough decisions like this without having to worry about financial fallout. Women who can control their reproductive lives can control their economic destinies. And personally, I've seen patients come into the clinic who are able to focus on the decision that they're making rather than all of the financial impacts that would happen if they had to come up with $500 or $1,000. And you can see the stress melt from their faces when they know that their procedure is going to be covered by insurance. The BBC has also written an article, and it's about the birth rate harming their poverty goals. So it was focused on some women in Africa, but I believe it applies here. If we're wanting to get poverty to a point where we are not having to worry about it, then we have to give women the freedom to choose what their life entails and hopefully move up and beyond poverty. So universal health insurance coverage of comprehensive women's health services is the first step to securing the ability to make tough health decisions without financial burden. And it gives them the opportunity to break the cycle of poverty among those women who are most at risk. In conclusion, if the government should keep their hands out of your wallets, off your corporations, and off your guns, they should keep their hands out of women's uteruses.